Welcome to the Mira Aesthetics Medical Center. If you're considering a tummy tuck, the common term for an abdominoplasty, keep in mind that this procedure is one of the more complex in the field of cosmetic surgery. Pay special attention when selecting a surgeon that the procedure that he or she performs is a true abdominoplasty and not simply a skin resection. Via this presentation, you'll have an opportunity to view actual results in real patients who have undergone a true tummy tuck by Dr. Mirrafati. You'll see firsthand that Dr. Mirrafati not only resects the skin, but also performs the also important additional procedure of tightening the underlying foundation and the muscle as well. Only through this method will you end up with the proper tightening and flatness you desire. Please be informed that this is the only true acceptable method that should be performed in any authentic abdominoplasty procedure. It is imperative that the muscles are tightened all the way from the xiphoid, below the rib cage, down to the groin area. If this crucial procedure is skipped, as it can be, it will result in herniation or bulging of the abdomen. Dr. Mirrafati is a published authority on abdominoplasty and the aesthetics of the abdominal wall. His reference book is a staple of physicians and cosmetic surgeons around the world to keep abreast of the latest techniques in this field. Dr. Mirrafati will thoroughly examine you to determine the specific type of abdominoplasty you individually require, and will tailor the incision to fit your body shape. Now, let's turn things over to Dr. Mirrafati in order for him to best explain to you the technical aspects of his tummy tuck procedure, the authentic method of abdominoplasty.
Hi, my name is Dr. Mirrafati, and I'd like to thank you for coming to our clinic. Today we're going to be discussing abdominoplasty procedure. There are two types of abdominoplasty. There's a full abdominoplasty and a mini abdominoplasty procedure. As depicted in this picture, this would be a good candidate for the mini abdominoplasty procedure. She has fullness in lower abdomen, looseness of the lower abdominal muscle, and a skin hanging in the lower abdomen. The procedure is as follows. We can do liposuction of the upper or lower abdomen and the waist region. Next, there is going to be an incision in the pelvic region. The incision would be like a C-section scar. The scar in most cases will fade away, but sometimes can take up to years, and it is well hidden. Next, the lower abdominal muscle are tightened and brought together. The belly button is not touched or released. Next, the lower abdominal skin is pulled down and the excess skin is resected. To summarize, the advantage of the mini tuck is that the recovery is much faster, the scar is nicely hidden and small, and the liposuction can safely be done at the same time to sculpt the body. Now talking about the disadvantages of the mini abdominoplasty procedure is that the upper abdomen is not touched other than liposuctioning it, and you're only relying on the skin retraction alone, which in most cases can be satisfactory. Now let's talk about the full abdominoplasty procedure. This would be a great candidate for full abdominoplasty procedure. She has fullness in the upper and lower abdomen, muscle looseness in the upper and lower abdomen, and lots of skin hanging in the lower abdominal region. This patient particularly has many stretch marks in lower abdomen, which would be gone. Remember, only the stretch mark in lower abdomen would be gone. The scar would be in such figure. The muscle from upper and lower abdomen is brought together and tightened, the belly button is removed and repositioned, and the skin is pulled down and the excess skin is resected. Let's talk about the advantages of the full abdominoplasty procedure. The result is much more superior. The muscle and skin from the upper and lower abdomen are pulled and tightened. The disadvantages of the full abdominoplasty procedure is as such. The recovery period is slightly longer. The scar is slightly longer, but still can be hitting along the bikini line or your underwear line. At the end, I'd like to thank you for your attention, and I hope this video helped you make some informative decision about your abdominoplasty procedure. We will come in and go over some of the risk and complication of the procedure, as well as some more detailed aspect of the surgery. Thank you for your attention.
Concerning my tummy tuck, that was one of the most important things to me. I've had 3 C-sections, 3 children, and I have always been active, exercised a lot, but after having the children, the skin would not go back any further. So I was very concerned, and after talking to Dr. Mirrafati, he said that we could get me back to almost where I was. So in having that, I knew there would be some discomfort and pain, but I must tell you, within 4 days of following his instructions to a T and taking very good care, I felt very good and I looked wonderful. My stomach is virtually totally flat. I'm down to a 2 or even a 0 in some cases. I feel wonderful, and I would do it 10 times if I had to again.
I was really happy with the results that I got. My stomach, I had a lot of loose skin because I had lost a lot of weight, and I wanted a flat, tight stomach, and with a tummy tuck, I was able to get that. I feel, better in my clothing. I wear a smaller size, just everything. I have more energy, and I'm just all around happier. Dr. Mirrafati was wonderful, and his staff was great, and I'm so glad that I did it.
At the time when I first stepped into this office, I wanted to reduce the size of my breasts. During the consultation, Dr. Mirrafati had suggested a tummy tuck. Dr. Mirrafati listened to me. He actually listened to me, but the great thing was, I know I wanted one thing, but he suggested something else, which was the tummy tuck. To bring stuff together for where I was at and where I needed to go, that was the proper choice first, was the tummy tuck. The tummy tuck was extremely pleasing to the eye. It was something that I had never been able to achieve. As a younger child, I had my appendix removed and I never had really strong muscles. So by having that done, I would say, I've never had children, so I didn't know what to expect. Just the whole flatness, the feeling of like, you stand up, you have confidence. I know my clothes fit differently. I mean, it was immediate result.
I hope you found this presentation informative and have a clear knowledge of the treatment. Thank you very much for watching.